All right, so we've been talking about fraud and compliance and keeping an active compliance plan. And one of the key points with the word active means that you're actually doing something. So one of the key points in a compliance plan is to make sure that you yourself do your own quarterly self-audits. That you don't wait for an insurance company to say they want to do an audit of 10 files or more and then look at those files and correct them. In other words, every single quarter, what you do is you pull random files off the chart. And you have staff members who understand what a self-audit should be and take advantage of all the points, and that they verify that all the notes and the codes and the billing all line up, and that they do in fact necessitate the care that was given. Now, a lot of times the doctors don't have staff trained up to do this, so if you don't, then you're right. It is something that at least you should do, and you should make active notes of what you've done, the files you've audited, anything you found that was wrong, and then anything that you've done to correct that. Then once you have done all of those points, you then present a report, a quarterly report to the compliance officer, showing that you did a full self-audit, that you did in fact verify that all of your notes justified all of the codes that were billed, that all the codes that were billed were actually performed, and that you have a treatment plan that necessitates all of that work and the rationale for doing that. And I have found that as far as a chiropractic office, this is a downfall. This is an area where the doctor may in fact have provided the services and coded them correctly, but then they don't have the diagnosis to support it. Or they don't have the treatment plan to give the rationale for all of the treatment times. In other words, they do 20 rehabs, but they're not having a treatment plan that shows and justifies the rationale for those 20 rehab visits. So you have to make sure that you not only know your documentation, that your documentation is in, that your coding is in, that your diagnosis is in, but you also have to have an active treatment plan that justifies what you're doing and why you're doing it. So when you make sure that you have all these points covered, and an insurance company who says, hey, we want to review 10 of your files, you don't have the instant gag reflex. You smile, you send them on, knowing that you have done everything necessary to keep yourself compliant, and that those services are legitimate, and in fact you have medical necessity and rationale for those services, and you can rest assured that that after the review you will be paid for the services, or you will be able to keep the money for the service that you have already rendered.